Hello, my name is Nathan and I will be presenting how to properly image the sacrum with the AP axial projection. First of all, the clinical indications for doing so would include pathologies of the sacrum and fractures. The technical factors for the AP sacrum are a SID of 40 inches with a field size of 10 by 12 portrait. A grid must be used and the KVP set within 75 to 90 dependent on patient size. It would be most desirable if the patient's bladder and colon were emptied and free of continence prior to the procedure for image clarity. Before we get into positioning, let us talk about the basic anatomy of the sacrum. The sacrum has a shovel shape, which is concaved when looking at it in an AP view. From top to bottom, we start with the body of the fifth lumbar moving inferior to the L5, S1 joint space. This then continues to the promontory of the sacrum. On both sides of the lateral, superior portion of the sacrum are the ala. Lateral to the ala is the sacroiliac joint. The body segments are located between the pelvic sacral foramina and at the bottom of the sacrum is the apex. Next, let's talk about important landmarks for positioning. The center ray for an AP axial sacrum is aligned mid-sagittal and 2 inches superior to the symphysis pubis. The symphysis pubis is never to be palpated, so an alternative landmark can be palpated that is similar in location, which is the greater trochanter. The ASIS is also another landmark that can be palpated. The central ray should be positioned about 2 inches inferior to the ASIS. Also, make sure the light field is at the level of the iliac crest, so the L5 is not cut off in the image. Place the patient in a supine position with arms at their side. Put a pillow under the head for comfort and legs extended. Place a support under the knees for comfort if desired. Angle the central ray 15 degrees cephalad as shown. Use proper collimation and place your right marker in the upper right of the light field as displayed. We will start by getting the central ray 15 degrees cephalad. Then, feel for ASIS. Move the CR 2 inches inferior to the ASIS. Make sure that the CR is mid-sagittal on the patient. Place the right marker in the upper right corner of the light field. Have the patient suspend respiration and take the image. The image should be free of any obstructions in the lower bowels. The image should demonstrate the entire sacrum, SI joints, and L5, S1 intervertebral joint space. There should be no rotation on the sacrum, demonstrating the sacrum free of foreshortening. Correct angle and alignment of the CR will show the pubis and sacral foramina are not superimposed.